Good morning, everybody. I'm delighted to welcome you to this Digital Futures event, and you have a fantastic lineup of speakers who will follow after me. I was asked just to provide a short opening and some reflections on how the pandemic has impacted on research at Manchester and what we see for the future through lessons learned. So what was the immediate impact on the university, as on many organisations, was incredible short disruption and rapid adjustment. And the way it fell at Manchester in terms of the context for affecting research was that we had a large pool of staff immediately diverted to health and medical service delivery. We then had those who weren't involved in that impacted with the challenges of working from home or remotely more generally, and many of those had homeschooling challenges as well as many other personal challenges to navigate. A lot of our academic time was diverted to stabilising the ship, really, in relation to teaching responsibilities, supervision of research staff and postgraduate researchers, and more generally pastoral care, both for our students and our team members. The most visible bits perhaps were, though, that our laboratories, most of them, except those immediately addressing the health issues of the pandemic in terms of clinical trials and vaccines and so forth, closed. Less visibly, a lot of our non-laboratory work was also disrupted because people could not travel to do field work. There were restrictions on in-person research. Archives were closed. Ethnographic participation was no longer feasible. And so while a number of colleagues pivoted or reprofiled the stages of their research, whether it was in laboratories or outside, there was the transaction costs of rescheduling your project. And for some, it simply meant research had to pause. What did we do to mitigate? Well, we took a number of activities. The first was many of our researchers across the university, both in health and medical research, social sciences, engineering, right across the piece, mobilised around what we called the COVID-19 research rapid response. So this was undertaking new research directly addressing the pandemic or pivoting what they were doing already to address the pandemic. Much of this was externally funded, but not all of it. And we set up rapid processes for ethical review and sign-off of projects so that we could respond to the immediacy of the crisis. As soon as we could, we reopened labs, but they are still operating at reduced capacity because of social distancing. And we put in support, part funded by UKRI, which is the main research funder in the UK, public research funder, and University of Manchester Match, to provide support for postgraduate researchers whose work had been disrupted because they're on a finite scholarship to support their research, and also research staff whose contracts were due to finish imminently. We wanted to give them a bit of stability as the immediacy of the first lockdown started. Since then, we've had additional financial support to support research staff through UKRI as well. We set up various activities to support all our students, but particularly focusing on the research side for this presentation. We set up a hardship fund, generously supported partly by our alumni and other donors, and we arranged for equipment for those who were working from home. And then, of course, given its digital futures, we should focus perhaps on the huge remote working and digital infrastructure that was mobilised to enable colleagues to do the best they could in the circumstances with their research, teaching and other responsibilities. We rapidly brought online things which were already in train. In the teaching areas, it accelerated much of the developments which were pre-COVID around online facilities, online lectures and so forth. And in research areas, for example, it meant we moved to set up procedures to allow remote vivas for the final examination, impact statements for those whose work had been materially disrupted, so that could be taken into account with the assessment. And we introduced a lot of remote events, which have had the benefit of actually reaching a wider audience than many in-person on-campus events. And we found that digital working has been productive for some activities, but not all. And that's something we're assessing as we go forward. So to give you a flavour, collaboration is a lot harder for many activities online, but we found that meetings and online events have often run even more smoothly with higher attendance and so forth. So, looking to the future, what have we learned? Well, we've learned that digital transformation could and is improving how we research in many ways. We've developed, shared, accelerated and learnt agile and new productive research practices. A key example here would be the acceleration in terms of early release and sharing of results, particularly around vaccines and trials as scientists have mobilised across the world. And the whole open access movement has gained additional momentum. That's just one example. There'll be lots in your own teams of how you've learnt to work remotely and share practice in this area. We've also learnt through this, but through digital, what some of us already knew and some of us were already practicing, that work can take place anywhere. So some of our collaborations with our international partners in Melbourne and Toronto, which would have involved travel usually and meetings, have actually moved pretty seamlessly to more frequent online contact. So one would anticipate when we are able to travel, we will be doing less of it and thinking more reflectively about what is needed for travel and when that really adds value to the task in hand. We've also learned a downside that it's very hard to set boundaries to the working day, and we are looking at that in the university in terms of making sure people feel entitled to switch off, entitled to take holidays, entitled not to chase the sun in 24/7 working across the world just because we're at home and we're digitally connected. And we found that it supports many more different types of collaborations and ways of working. It's also helped reduce the carbon footprint, and we'll see how that pans out as we move out of lockdown. Of course, some of that has been displaced to home heating and so forth, but we estimate that there's a net reduction if you take commuting and the costs of running large organisations into account. And certainly for the future, it will make us think about what size and shape of estates we need to support research and teaching. There are probably others that you will have thought about and will perhaps bring to the discussion later. So finally, just a reflection on what this has meant for our research and the role of research in public life. So there's been the immediate and obvious and very visible role of scientists in tackling and helping to mitigate and solve the pandemic. Very, very visible, of course, around vaccines and those developments, but also research, some of which you'll hear about later today, around the social side of living with a pandemic and the economic impact, whether it's through loneliness or through to other side effects of health, or how people connect and build communities digitally. We've seen our research influencing, as it always has done, the policy and politics of public life. And we've seen some of those challenges play out in tensions in the UK between scientific advice on how to unlock, and not all the scientists agree, of course, and the juxtaposition of that with politicians' other issues that they need to consider, notably the balance between the economic costs of lockdown versus safety. And we've seen that play out between the Treasury, the Prime Minister and other ministers vis-a-vis drawing on, but not always listening to scientific evidence. And finally, the third role is, of course, around public engagement. The pandemic has heightened awareness of the role of science, and we've seen much more visibility in the UK of various scientists commenting, evaluating, critiquing the way that the political decisions have been made, but also hopefully informing the public, such as about some of the side effects and dismissing some of the scare stories around vaccines. So that's all I wanted to say to open the meeting. So I'll close my slides and hand back to Sarah. Thank you.